Hey everybody, this is Dr. Joe Borio with this week's Health Kick, and I got a great shirt on by one of my buddy chiropractors, one of my fellow chiropractors. Talks about his clinic, and then it goes over the drug problem that we're having in our country. You guys have heard me go off on that quite a few times, but it talks about taking an aspirin, Zocor, and every other kind of drug you can imagine. You know, it's so funny in our so-called treatment mentality. You know, there's a drug for every ill. I mean, think about it. If you got a headache, there's a whole series of pills. There's aisles dedicated to people with pain, and there's aisles dedicated to people with a cough or an allergy, or if you're too happy or too sad, or your bladder doesn't work, or you're constipated, or you got diarrhea, or you got a skin problem or an infection, or you know your sexual function's off, or whatever. And I can go on and on and on all day. We got to realize at some point how ridiculous that is, because you got to step back and say, listen, that isn't why the body is sick. Now, I'm not saying I want people to be martyrs out there and not ever take a pill, but the reality is that isn't why the body is sick. There's something going on in the body, and true wellness, true health is trying to identify exactly what it is, and then certainly trying to correct that deficiency, right, or that excess, or a loss of proper function of the body so the body can work the way it's supposed to. You know, chiropractic philosophy is so beautiful in that we start with the first understanding that the body is a self-healing, self-regulating organism. And just like a plant, for example, you've heard me use that example before. So if a plant's ill, you don't say, geez, let me put some Lipitor and Prozac and triple antibiotic in it. I mean, you look at that plant and say, geez, what's it deficient in? Water, sunlight, or nutrition? One of those three, almost always, and boy, that plant starts to come back to normal function and normal health and wellness. And then if you sustain that type of care for the plant will live its life in a very healthy state. And we forget that the body's intended to do the same thing. Today, what I wanted to talk about, unbelievably, even because I already started talking here for a while, was ear problems, ear infections. Childhood ear infections. We don't even want to call them infections. Most of the time, they're not infections. They're actually inflammation of the ear. Otitis is a Latin word for ear, if you will. And media, the middle of the ear, is infected or inflamed or has some type of fluid in it. And we have to understand that the middle ear, and I'm going to edit a diagram in here for you, but the middle ear has a cavity in it, and then it has a tube called a eustachian tube that drains down in your throat. And what happens is the middle ear is a mucosal membrane, like the inside of your mouth. You know, it's red, it's got a lot of vascularity to it, and by having a lot of blood, it means it makes a lot of mucus. It's got cells that make mucus and other types of fluid, and that allows the body to be bathed with nutrients and different types of liquids that are very healthy, fluids that are very healthy for that tissue, to keep it moist and keep it with proper nutrition so those tissues work the way they're supposed to. And what happens sometimes is the eustachian tube more often will tend to get blocked, mechanically blocked. Now, the eustachian tube is a tube that's like muscles, almost like an artery or a vein, and it can change its diameter. Think of like a straw. So if you press on a straw and it kinks, or a hose and it kinks, it doesn't allow fluid to drain through the ear. It also doesn't allow the middle ear to equalize itself to pressure. So the pressure of the atmosphere, if you will, the outside, doesn't equalize the inside. You may notice that if you go deep in the water, in a pool or a lake, or if you go up in an airplane, you feel this horrific pressure sometimes in the sinuses or middle ear. That's because those openings aren't allowing pressure to regulate back and forth, and as a result, the body doesn't work as well as it's supposed to. So what does all this have to do with what we do as chiropractors? That is that the first bone of the neck, and again, I'll edit a diagram in here, the first bone of the neck actually can press on the tube, and it causes what we call a mechanical blockage. So mechanically, there's something that's pressing directly on the tube, thereby it doesn't allow the extra fluid or just the normal fluid to drain. Now in children, infants for example, much more so than adults, the tube tends to be a little bit more horizontal. As we grow, the tube tends to become more vertical and allows proper drainage to occur through gravity, a little bit through gravitational forces, much more naturally than it would in a child. But in a child, they're more horizontal. So when you lean a child back with a bottle, for example, and they swallow, sometimes it forces pressure or fluid up and through the eustachian tube. Not very good for the tube. When children lay down with certain fluids, or if they're eating and they're laying down eating, very bad, because it can force saliva and different fluids up through the eustachian tube. But with the normal childbirth, the first vertebrae can misalign, shift, and cause pressure on the tube, not necessarily causing an ear infection, but what it'll do is cause mechanical blockage, prevent fluid from dripping through there. Now, what also can happen is neurologically, there's small nerves that regulate the size and diameter of the eustachian tube. These nerves can be affected by misalignment of the upper cervical, by either being out of alignment or the upper area being irritated, or by the first or second cervical vertebrae being stuck in position will irritate those nerves, and therefore it won't allow proper drainage to occur, and as a result we build up extra fluid. So that can be a main cause. Another cause can be allergies by becoming exposed to different antigens and proteins out in the atmosphere. Your body gets irritated like you would with runny eyes and extra saliva in your mouth. You'll build up more mucus in the middle ear, and as a result you're building up mucus faster than it can drain. That can cause pressure. You can have a viral infection or a bacterial infection. That's what most people are more familiar with, and that can cause a raging amount of pressure in the middle ear, faster than the tube can either drain or the tube can swell, and as a result you're not getting any drainage. Now the eardrum starts to get stretched and gets pressure, and that can cause severe pain or a lot of pain for a child. So the first and best thing to do is take a look inside the ear, take a look for the lymph nodes. If there's a lot of lymph nodes and so forth, we're going to want to use a warm compress to try to drain it. We're going to want to adjust that upper cervical vertebrae as soon as we possibly can. Almost always it'll immediately drain the fluid, whether it's bacterial, viral, due to an allergy, due to just mechanical blockage in and of itself. That area will drain. The adjustment will also help out the immune system. So if it is allergy, viral, or bacterial, when we adjust this area and move it back in a better position, it allows a heightened response by the immune system. So this has been shown many times over where these upper spine vertebrae get adjusted, and it sends better communication to the white blood cells. The white blood cells become more active. They fight off infection faster. They actually activate the T cells, so they fight off infection faster. So by getting adjusted, it greatly enhances your body's own ability to fight off infection. Really great stuff. We certainly want to stay off a lot of milk, dairy products. They're mucus producers. We want to make sure we have good, healthy probiotics, as I talked to you guys about before. We want to make sure we got proper fluids. We definitely want to stay more vertical as infants because that'll help the ear drain much faster. Guys, we're running out of time. I really appreciate you tuning in. I appreciate all the great comments that we've been getting in. If you'd like to be a member of our practice, certainly just give us a call or look us up on the website at boriochiropractic.com. We'd love to have serve you and your family with great chiropractic care. For those of you that are not local to us in central New York, certainly give us a call. We'll find you a great chiropractor that's really principle-based and that's wellness-oriented. And those are the chiropractors you want to really seek out if you're looking for true health and wellness care, which is what we provide in our office. Guys, this has been Dr. Joe Borio. Remember, you, your mother, your father, your grandfather, everybody you know needs to be under chiropractic care. You need to get a good night's sleep. You need to get some regular exercise, some good fluids. You need to get good nutrition in your body. And like I said, you got to get those great chiropractic adjustments. You should be getting adjusted one time a week or every 2 weeks is what science is showing. Keep that spine healthy, keep the messages flowing, keep you and your family as healthy as they can be. Guys, have a great week. Have a wonderful Easter or Passover. Or for those of you that don't celebrate, certainly have a wonderful holiday season and enjoy it with your family and kids. I look forward to talking to you guys next week.